What is dermoid sinus in Rhodesian Ridgebacks? Have you ever wondered about the health concerns specific to certain dog breeds? Today, we are focusing on a condition known as dermoid sinus, particularly in Rhodesian Ridgebacks. This congenital abnormality is present at birth and is something every owner should be aware of. Dermoid sinus involves a tube-like tract that forms in the skin along the midline of the back. It often extends downward toward the spinal canal. This tract is lined with skin tissue, which includes hair follicles and sebaceous glands. Because of this, it can collect skin debris, hair, and oils over time. The root cause of dermoid sinus is linked to issues during early embryonic development. Normally, the tissue that forms the skin and the nervous system separates completely. In Rhodesian Ridgebacks with this condition, that separation is incomplete, leading to a persistent connection between the skin and deeper tissues. This connection can sometimes reach as far as the spinal canal. Dermoid sinus is more common in Rhodesian Ridgebacks than in other breeds, suggesting a genetic basis. Some studies indicate that it may involve problems with the absorption or use of folic acid, a B vitamin essential for development. While the exact mode of inheritance is not fully understood, it is clear that this breed is predisposed to the condition. Owners may not notice dermoid sinus immediately after birth. However, as the puppy grows, painful swellings along the back may become apparent. These swellings can sometimes discharge, and the tract can often be felt as a cord beneath the skin. If the sinus extends into the spinal canal, there is a risk of infection spreading to the nervous system. This can lead to serious complications such as meningitis or myelitis, with signs including spinal pain, stiffness, or weakness. To diagnose dermoid sinus, a veterinarian will typically perform a physical examination and may use imaging studies like X-rays with contrast dye. This helps determine how extensive the sinus tract is. The only effective treatment for this condition is complete surgical removal of the tract. If any part of the tract is left behind, the condition is likely to return. The complexity of the surgery can vary, depending on how deep the sinus extends. For pet owners, being aware of dermoid sinus is essential, especially if you have a Rhodesian Ridgeback or are considering breeding. Early detection and treatment can help prevent serious health issues. Regular veterinary checkups are recommended, particularly for puppies and young dogs of this breed. This proactive approach can help identify and manage dermoid sinus before complications arise, ensuring your furry friend stays healthy and happy.